I'm Anthony with marketing, and it's my pleasure to introduce Dr. Kathleen Carson, owner of Integrative Dental Arts in Agoura Hills, California. Dr. Carson graduated cum laude from the UCLA School of Dentistry and served a general practice residency with the Veterans Administration in Sepulveda. She earned her fellowship in neuromuscular physiological dentistry as well as Butiku breathing. She serves on the board of the AAPMD and is a clinical advisor for Vivos Therapeutics. For nearly 20 years, Dr. Carson and her team have focused on a comprehensive care model utilizing a variety of integrative modalities to improve overall health and well-being of patients. Committing to advancing healthcare professionals' perception of airway-centric dentistry, she has dedicated a large portion of her education and personal growth to the importance of airway and oxygen delivery. During the presentation, feel free to submit any questions you may have. Dr. Carson will allocate 10 minutes at the end to answer as many as possible. With that, let's get to it.
All right, thanks. Hi, I'm Kathleen Carson. I'm in Agoura Hills, California. I have a general dental practice for the past 20 years with a number of patients that I focus on TMJ and airway treatment. I've been using CBD in my practice for the last probably 3 years. It's made a fantastic change in a number of my treatment modalities, and we've seen great results. So it's my pleasure to share this info with you. I have no connection to the product other than I use it and I love it. And I think everybody should learn more about it because I do think it can make a big difference in your practices as well. So we're going to be talking about CBD tonight. And CBD is one of many what are called cannabinoids, which is a term that's very, very general. A cannabinoid is a specific group of chemical compounds that are found naturally in two places, animals and plants. So obviously CBD is found in plants. It is therefore called a phytocannabinoid. And phyto meaning plant and cannabinoid meaning the molecule it is. The other place it's found naturally is in animals, including ourselves, cannabinoids known as endocannabinoids when they're found within animals. There are now also synthetic cannabinoids as well. But we're mainly going to be talking about CBD today, but I think it's important that you guys understand how the entire mechanism works. So we'll be touching on that as well. So I want to say thank you to Sterngold for being the sponsor tonight. And if there's any questions, there is a question box. Please feel free to submit it. I'd be more than happy to answer them as time permits. So let's get started. There's a number of reasons you might consider using CBD in your dental practice. These are a few of them. TMJ and facial pain is often what I use it for in my practice. Along with that is the head and neck discomfort, myofascial pain, post-operative procedures. It's great. It's great for managing pain, long open mouth procedures. Another thing that we like to use it for in our practice is if we're introducing any sort of appliance therapy, it really helps patients adapt to it better, getting rid of any of the muscle fatigue that can be associated with it. Is really what are our current options right now. There are narcotics, NSAIDs, maybe some Tylenol, massage therapy, ice packs, acupuncture. This is another great option, and hopefully by the end of this presentation, you'll agree. Here we go. So cannabis. Cannabis is a species of plants. It includes both the marijuana and the hemp plant within that species. So legally, hemp is defined as a cannabis plant that contains less than 0.3% of THC. So hemp is really where, if we're going to get a cannabinoid out of it, a phytocannabinoid, that's where CBD can be harvested. There really isn't any THC in hemp. Marijuana can have a variety of different levels of either THC or CBD, both, and a number of the other phytocannabinoids. So they're a part of the same species, which is the cannabis species. A lot of times there is confusion there. So the CBD products that I'm mainly talking about today are derived from the hemp plant because that is what's legal across the country. I'm not sure what the individual state laws are anymore. Out here in California, we can use medical marijuana legally, so we could use CBD products that also come from maybe a marijuana plant that have a higher percentage of THC in it. But that's not typically what I use in my office. Patients may choose to go that route, but what I'm going to be talking about and what I typically recommend is the pure CBD products. They are the medicinal products out there. THC is what's found in marijuana that gets you high. CBD is not that component at all. It only has medicinal value. It will not create a psychotic reaction in your patients. So the research of CBD has really been banned until recently. In 2018, there was a bill passed called the Farm Bill, and hemp is now considered an agricultural product. So that's why all of a sudden the floodgates are open for research on this. But with hemp, again, it has to have 0.3% THC or less by dry weight. So that's what is legal pretty much for everybody, or absolutely for everybody. So that's the difference between hemp and marijuana. There's actually over 100 phytocannabinoids that are already identified. CBD and THC are only 2 of these, okay? And they produce effects in the body because they attach to certain receptors that belong to an internal system that we and many animals have called the endocannabinoid system, okay? So if THC is going to interact with our endocannabinoid system, it is going to produce some degree of a high, whereas CBD is completely non-psychoactive. They can work together and supplement each other as well. In fact, if you're combining the two, CBD can actually change how psychoactive THC can be. Just an interesting component to it. So if you have somebody that accidentally took too much marijuana, is feeling too high, you can flood them with some CBD, and that can actually reduce the effects of it. Marijuana itself, there are different plants that can be bred with different percentages of all these phytocannabinoids, resulting in different effects depending on the desired results. But again, that's outside of my scope of my clinical recommendations. I'm going to be sticking with the CBD products. So pure CBD, extremely low levels of THC, 0.3% or less. It can have other phytocannabinoids mixed in there. There's CBD, CBN, CBG, CBC. In general, you mix them together, you're going to get something called an entourage effect, which I will explain a little bit later. CBD is known for its therapeutic benefits, not get you high. Even the World Health Organization came out in 2017 and said there's no potential for abuse of this, and there may be health benefits at all. So to me, that's the biggest question for my patients. What are you going to consider health? Is health the fact that there's an absence of disease, you're not sick? Or is health that your body is actually functioning the way it should be and that everything is working to the best of its ability? Because that's what our endocannabinoid system is really there for. Its major job is to maintain homeostasis throughout all of our systems so that our body can stay healthy. So that if something comes in and disrupts our system, throws us out of a balance, maybe pain, inflammation, illness, our endocannabinoid system is actually what helps bring our body back into balance and maintain its homeostasis. It gives us the resiliency to really bounce back. So the endocannabinoid system, to understand how it works, which is important to know if you're going to be considering using CBD. So it's perhaps the most important physiological system, and it's involved in maintaining and establishing homeostasis. Now, none of us learned about this in school, or maybe you did if you just graduated, I don't know. But I learned about all those other organ systems you see on the screen. But the fact that the ECS wasn't even discovered until the 90s is why we really didn't learn about it. But it has the most receptors in our body. So if you take all of our other systems combined and look at the receptors in their cells, the endocannabinoid system actually has more than all of them combined. Which is fascinating that it plays such a huge role, and we just, never really knew about it. It was discovered, like I said, by the Israelis when they were trying to find out what was causing people to get high when they were using THC. And so they were able to track that molecule in the human body and discover this crazy massive array of receptors. And that was when the system was discovered, but that's also when there was a ban on using basically research on all of the plant, not just THC. So now that we recognize that there's so many other benefits from it, everything is, we're able to look at the plant, multiple components on how they can help us. So very simply, the job of the endocannabinoid system is to regulate the flow of signals between our cells with the goal of maintaining homeostasis. So it's the way our internal environment responds to changes in the external environment. And it really is very vital to maintain our health and wellness. These systems exist in any animal with a vertebrae. That includes fish, reptiles, birds, mammals. And they bring the balance back to our tissues, including our heart, our digestive system, our endocrine system, our immune system, our nervous system, our reproductive system. So its function is huge, and we're learning more every day. If you just, Google CBD, THC, endocannabinoid system, whatever it is you want to throw out there on the internet, you're going to see research and articles coming out constantly, because we are just learning more and more every single day. Like I said, it is the most widespread receptor system in the human body, and it is involved in just about every chemical process in our bodies. So if we're looking at the system, there's basically 3 core components to it. So I'm just really going to simplify this. The basic components are the ligands, which are the endocannabinoids within our bodies. So we're talking about endo meaning internal. So these are the chemicals that we are producing in our own body. There's 2 of those. There's actually a 3rd one that's been discovered. There's the receptors. That's what the ligands bind to. There's 2 main ones, CB1 and CB2. We're finding additional receptors now. And then there's the specific enzymes that are either involved in the production of our endocannabinoids or the destruction of them. So these are compounds that are produced naturally within our body, and they bind with the cannabinoid receptors, and these receptors are located on cell membranes. And what happens is actions are induced within the cell that are needed to carry out whatever essential life functions our body needs to stay in homeostasis. So as soon as the body's thrown out of balance, it signals the endocannabinoids and the receptors for assistance. So our endocannabinoids, again, this is what the bodies produce. They are not actually synthesized in advance. They're made when and where they're needed, which is very unique to this system compared to other systems in our body. So let's just say there's a trigger, and so we're going to produce these endocannabinoids. A trigger can be anything from an injury to an illness, inflammation, or any other imbalance, and they're going to address this imbalance at the level of the individual cells. So if we're talking about, other options that we might look at taking in terms of medications, there are no pharmaceutical medications out there that do that. They're covering the symptoms, the signs. They're not treating the actual cells that are causing the problems, whereas our endocannabinoids, that's their job. That's what they're doing. And they work by retrograde signaling. To throw you all back to dental school, retrograde signaling, very simplified. Your cell produces, something's going wrong. Your body's like, okay, need to produce this endocannabinoid. It will go work on a postsynaptic receptor, and that other cell will in turn send things back and modulate the cell from the beginning. So I don't want to get super complicated. If you want to look up retrograde signaling, you can dive deep, but that's how our endocannabinoid system works. So simply put, it regulates the flow of signals that are being sent between the cells with the goal of maintaining balance and homeostasis, and they're released when and where they're needed as a response to that trigger. So the endocannabinoids that we've discovered so far, I'm going to talk about the 2 major ones because they're the ones that we know the most about. AEA, anandamide, is also known as the bliss molecule. So this was the first endocannabinoid that was discovered by researchers, and it impacts literally every system in our body. It's mostly active at what is known as the CB1 receptors, which I'll talk about next. Broken down by the Fa enzyme, has a very, very short half-life, less than 5 minutes. Its functions are huge. We do know that sleep deprivation will result in a deficiency of AEA, and this results in memory loss the next day. A lot of my patients that I'm working with in my practice do have sleep issues. So if there's a deficiency in their endocannabinoid system, CBD is potentially something that can help them out. We'll talk a little bit more about that later. Less is known about this endocannabinoid. It was identified a few years after AEA, but it does have a pretty strong affinity to the receptors. It's metabolized by a different enzyme, but we know it's more focused in the gut and the neuronal system. We know also that levels of this can be altered by an unhealthy gut. I mean, how many patients do you see? How many people do you know that have unhealthy guts? It's everywhere. Leaky gut is everywhere. CBG can actually impact this receptor, but this is a relatively new discovery. So the 2 receptors I'm talking about right now are the two main ones that we know of. Like I said, there's a third receptor and a couple other places these will interact. Research is coming out all the time, but these are the two that we know the most about. So once manufactured, our endocannabinoids will attach to these receptors, and these receptors are literally everywhere in our body. There are more present in the body than all of our other neurotransmitter receptors put together. So when they're activated, these receptors can be activated either by our own internal endocannabinoids, or if we're putting a phytocannabinoid into our system, that's where these chemical compounds interact as well. And another interesting thing is our cells don't just have these receptors sitting on their membranes. Our bodies actually know when they're needed, and we can put them out, or our body can put them out onto the cell membrane so that they can be activated when they're needed. They add them, take them away, just depending on what our body needs. So those receptors, CB1 receptors, those are concentrated in our brain and our central nervous system, but they're found everywhere else in our body as well. That's just their major concentration. So they deal with thinking, they deal with mood, appetite, memories, pain, emotion, movement, coordination, lots and lots of functions. Whereas the CB2 receptors are mostly in our peripheral nervous system, especially in the cells associated with our immune system. A lot of tissues have both of the receptors present in equal amounts: the heart, the liver, the GI system. It's, our gut nervous system, our reproductive system. So literally everywhere. So the term endocannabinoid deficiency, this is what is going to be important to understand, because this is why products like CBD really work. Because when your ECS, or your endocannabinoid system, is not working properly, you can have an imbalance, which can manifest as a medical condition. So, what might cause this? It can be anything from being something that's genetically determined or developed later in life. We know that things like chronic stress, who's not under chronic stress, poor diet, chronic pain, chronic inflammation, they've all been shown to negatively impact our endocannabinoid function. So the links between the deficiencies in this system and the numerous medical disorders has been really surprising. That's what researchers have found, and they're now hypothesizing that it could be the underlying cause of many of those ailments that we really just don't have the answers to. So things like fibromyalgia, IBS, chronic pain issues, we're finding that CBD and related products can really, really help. So in general, the theory of the clinical endocannabinoid deficiency is it can either be that we don't have enough of the endocannabinoids, so therefore we can use these phytocannabinoids to supplement our body, or maybe we have too few receptors, or possibly it's the enzymes that are making them or breaking them down. But there's a lot of research going into this. This theory was first proposed in 2004, but again, it's why we're thinking that supplementing with phytocannabinoids such as CBD are proving to alleviate so many of these conditions that we're seeing. And they're thinking it can be so common and prevalent that people just have no idea that this is out there to help them. So how do they work? Okay, so we have these receptors on the cells, right? And our natural endocannabinoids are binding to them. What happens when we add in the phytocannabinoids? Well, THC, which is the predominant phytocannabinoid in marijuana, the one that gets you high, actually works as a lock and key on CB1 receptors. So it will go in and bind with those receptors. Other phytocannabinoids, such as CBD, actually don't necessarily work like a lock and key, but instead they'll modulate our receptors, so they'll change how other compounds interact with them. It's also been shown that CBD can directly influence inflammation and serve as an anti-inflammatory agent itself. Another way it can work is by delaying the reuptake and breakdown of the endocannabinoids themselves, so it allows them to last longer. And like I mentioned, CBD can change the actual shape or how our receptors interact with other molecules, so that's why it can interfere with the effects that THC can have on people. So still have a lot of research going on there, but it's amazing what we can learn from this system. So the reason CBD really, really helps is we're technically using a natural medicine to target the non-functioning system, right? So if our ECS isn't functioning and that's causing inflammation to go out of control, or it's increasing pain because our body's not able to help itself, we're actually using medicine to target our own cells to heal themselves. So that's how it can do so much, because it's not just going out there and reducing pain, it's actually helping our body say, hey, this is what needs to be fixed, this is what needs to be changed, let's heal ourselves. So another thing that can happen is the enzymes that break them down, they can be too high. We know that things like stress can increase the Fa enzyme, which can break down our naturally occurring endocannabinoids faster than they have the ability to work. So then we have too little of our naturally occurring anandamide. So if we supplement with something like CBD, then we can allow that activity to last longer. So daily use of CBD can raise our natural occurring endocannabinoids. It can also inhibit the overproduction of those enzymes that break them down. And when you hear something called the entourage effect, which I'm sure you will hear if you've been learning about this long enough, what that means is there's different components to the plant, okay? So there's different phytocannabinoids that are present in marijuana, in hemp. And we know that certain components, the ones that have been researched so far at least, have their own medicinal qualities to them. Sometimes those qualities overlap, but many times when we have the ability to combine them, we get a more profound effect that can be beneficial to the patient depending on what they need it for. So unlike most active ingredients, most pharmacology type ingredients, they're only going to adjust in one direction, right? They're only going to take things down or bring things up. This is another great thing about CBD, is when it's affecting our endocannabinoid system, it can actually help us autocorrect either way. So if we need to upregulate something, we're going to upregulate something. But if we need it to downregulate something, it can actually work in that way too. And that's where it's working to maintain the homeostasis. So CBD can act in many ways to assist this, and allows our own endogenous system to work properly and self-regulate when it's not able to do so on its own. And anyone in today's modern world, I mean, I see patients every day, as I'm sure all of you do, that have systems that are just very, very inflamed. And then to some degree, all of us are going to be inflamed living in today's modern world with pollution, stress, infections, toxins. I mean, you can name it, diet. Our bodies are going to be inflamed to some degree. And we now know that this is probably inhibiting our ability to protect ourselves and to heal ourselves through our endocannabinoid system, just like it's inhibiting so many of our other systems in our body. So this is one way that we can help ourselves. So the studies, this is the best part. Okay, so CBD studies, they do show that relieves pain, relieves stress, anxiety, promotes bone growth. That's great. Inflammation, that's huge for our patients. It can even reduce blood sugar, help with muscle spasms, promotes good sleep. So it can correct imbalance by either enhancing or inhibiting how those receptors are transmitting a signal by working at the level of the individual cells. So very, very different than the pharmaceuticals that we're used to giving our patients. Pharmaceuticals are going to work at the level of the symptoms you're having. We're treating the cause of the imbalance with CBD versus chasing those symptoms. So if your ECS is not functioning well, simply put, you're going to be out of balance. If dysfunction of it is the culprit, then pharmaceuticals aren't going to target this. They're not going to be as beneficial. So some common uses for our patients, for dentistry. Why would you use this in your dental practice? Well, inflammation. I mean, we see that all the time. CBD can reduce inflammation by a variety of techniques, but really amplifying GABA. It can inhibit the reuptake of adenosine. It can boost the levels of it. Broad anti-inflammatory effect throughout the body. So inflammation, I mean, it's not always bad. We know that. So it's more of a warning sign rather than the disease itself. It's saying, hey, something's wrong. And typically it can correlate with many different diseases and conditions in our patients. It's a generic response to a threat to your health. But the problem is our body is activated, it activates the immune system to try to fight off this attacker. And if that attacker is how we're living our lives that's causing the chronic inflammation, then that's going to be a problem, because then inflammation can go unchecked and get out of control. So CBD can actually help reduce this because it will target certain cytokines, such as the pro-inflammatory ones, and decrease their effects. It can take the very cause of the inflammation signal and simply tell it to quiet down a little bit. So it would be great to be able to help our patients, ourselves, our family. I mean, I use CBD for this purpose myself, as do my family members, to help bring down systemic inflammation, and then maybe change some habits, change some lifestyle techniques so that you can use less of it or be healthier later on as we move forward. Pain, very, very good pain management technique. If we only have narcotics, NSAIDs, Tylenol, to help with pain, those have a lot of serious side effects, and I'll get to that in a few minutes. CBD does not have the same serious side effect threats as other medications, and it's non-addictive. So it will target pain by anti-inflammatory agents primarily, but it's also been observed to assist cells in the regeneration process. It can be used to reduce inflammation at the site of an injury, such as a sprained ankle, or maybe a jaw joint injury, or a dental procedure, something like that. But it can also be used to help treat chronic pain that is caused by things like pinched nerves, irritated nerve cells, forms of neuropathy. A lot of studies out there are showing that it is helping heal that as well. Another benefit is opioids, right? We all know that those are becoming a problem. CBD has been shown in studies to help decrease the prescribed dose of opioids and also help lessen the symptoms of withdrawal when people are trying to get off of them. So it's a great transition if you have those patients that, maybe need help in that way. Sleep. This is one of the main reasons I started using CBD in my practice, is to help my patients with sleep issues. The interesting thing is studies show it does help patients get better sleep, but they're thinking it's because it's reducing the pain, the inflammation, the anxiety, and bringing our body back into a state of homeostasis so that our system can actually heal and relax. In smaller doses of CBD, it can be somewhat alerting rather than allowing sleep. So in some patients, I will have them maybe take CBD in the morning, afternoon, but maybe not right before they go to bed. It's not the case with everybody, so that's a very patient-specific thing, but it definitely has shown to reduce anxiety, which is a major cause of insomnia. It increases overall sleep time at night. It can help with sleep onset in pain patients. It can help reduce insomnia, improve REM sleep disorder. It's definitely helped, like I said, my sleep and breathing patients in my practice. So CBD in the immune system. CBD is considered to be an immunosuppressant, meaning it's reducing the cytokine production and inhibits T cell function, but that's only part of the story. New wave of research and mounting evidence is showing that there's an adaptive immunomodulating effect as well. So it's not just suppressing immune activity, but when you need your immune system to be elevated instead of suppressed, it will actually help bring an underreacting immune system back into balance, as well as bringing an overreacting one back down into balance. So it's working both ways. So I do think in the future, outside of the inflammation and the pain control that I think is primarily the benefits my patients are seeing, along with improved sleep, I think that medicine is really going to start diving into these phytocannabinoids and creating some pretty cool products for our patients to actually get healthier, which is the point, right? Not just putting a Band-Aid over the symptoms, but to actually help the underlying causes. That's what we're talking about. So when patients ask you, or if you're curious, there's a bunch of products available out there. There's tinctures. Those are little droplets that can go under the tongue. There's things you can smoke. There's things you can chew. There's things you can rub on your body. They come in all shapes and sizes. It is the wild, wild west out there. There is no regulation of these products. So you want to be aware that your patients are getting good quality products, or at least that you're able to direct them to them. In my practice, I'm using tinctures, but I'm also mainly using topicals as well. Just because, I like to tell my patients, just because you can buy your sushi at the gas station does not mean you should. The same goes for CBD. Don't buy it at the gas station. You know, you want to make sure it's a reputable product. Just about anybody can distill these phytocannabinoids. So Uncle Joe next door, he could be making his own products in the garage, but there's different ways of distilling these products that aren't so beneficial. They could be using gasoline, propane, alcohol, and it can be turned into actually poisonous type products. You don't want to do that. There's safe ways to make them. There are third parties to monitor them. You want to make sure you are getting what you think you're getting, because it isn't necessarily what's printed on it. So you want to make sure it is properly monitored. And I'll go over what to look for in just a minute. But I get a lot of questions about, okay, well, how much do I take? Unfortunately, everybody's endocannabinoid system is very unique and very different, and we don't have a way to determine what level each individual is at and what level of treatment each individual could benefit from. But the good news is there's no lethal dose, there's no risk of overdosing, there's literally no side effects other than the typical placebo side effects. I mean, you really aren't going to do any harm with your patients with recommending these products. I find more often than not, they do help my patients with these signs and symptoms. Like I said, they do need to be self-titrated to find the correct dosage for each patient. Some people's endocannabinoid systems is very sensitive and can react to pretty low doses. The general rule of thumb is to start low, see what happens, start adding on. But again, there is no overdose on them. So simple approach, decide which method of delivery you're going to try. Is it the tinctures? Is it the topicals? For my office, it's usually one of those two things. Starting dose of 10 milligrams of CBD is recommended. It can go up to 200 milligrams per dose for a potent anti-inflammatory effect. No danger of overdosing. CBD is actually very, very well absorbed with the very minimal side effects. The side effects that are noted, just so you know, might be nausea, fatigue, and irritability. And that's according to Harvard Health Publishing, and it's the same as placebo. Start low, titrate up slow. So what do you want to look for? What is high quality? Okay, so you want to extract it using carbon dioxide method. This is a very safe solvent to extract the desired compound. It's free from any residues or additives, which is often not the case with using butane, pentane, hexane, anything like that. You want to avoid those CBD oils. You want to use something that's produced using a naturally grown hemp. That's hemp is a hyper accumulator plant. That means it will suck up any toxins that are in the soil, which can therefore get into the product. So you want to make sure that there's good vitamins and minerals, not harmful ones like lead, petroleum, things like that. So US Hemp Authority certified, grown on USDA certified soil. So the safest CBD oil is going to be sourced in an area where the government does require the farmers to be certified. Also pay attention that the price isn't too good to be true. High quality CBD oils are not cheap to make. So if the price is very, very low, that's a good sign that you're probably getting an inferior contaminated product. So again, don't shop at the gas station. You don't have to buy the most expensive product at all, which I'll show you. I don't use the most expensive product. I use a very fairly priced product that works really, really well. You're going to want to look for good, favorable customer reviews as well. The product label on the CBD products will usually display the amount of CBD and tell you how much you're getting. Usually 250 to 1,000 milligrams per 10 milliliter bottles, expect a good standard expected amount. More importantly, I think independent test results. That is what I was saying, where there's that third party that can actually monitor each and every batch that is out there and tell you exactly what is in that bottle that you're giving your patients or taking yourself or rubbing on your skin. So I wouldn't use a product that doesn't do that. So you can have, they have test results that you can view, and it'll state the levels also of the CBD that's present in there, the concentration, and that is really, really beneficial. So In my practice, how I go about doing this, the problems that I see, right? TMJ, head neck pain, myofascial pain, those long open mouth procedures again. Patients are relying on pain medication and analgesics to help them relieve the pain. Some of them are on daily doses. It's treating the symptoms, not necessarily the causes always. So the other thing we also know is, okay, let's say, what if a dietary supplement came out right now and it was proven to cause liver damage, liver failure, and death? Poison control calls, emergency room visits. I mean, if any of these products did that, we would not be having this conversation. But the thing is that's exactly what the drugs we typically give our patients do. If you look at the side effects and risk factors, you know, most people assume that over-the-counter medications are safe when taken as directed, yet they can cause ulcers, antihistamines can cause sedation, acetaminophen can cause liver damage. I mean, so when patients tell me, you know, I don't know about the side effects of CBD, if it's going to be harmful or not, you know, I'm not saying don't take Tylenol, Advil, and aspirin. I do. I mean, they've been proven to be beneficial for many reasons. But my point is that their side effects are far worse than what you're going to get from having somebody try a CBD product. It's far safer and it works really, really well. And we do have those patients out there who should not take NSAIDs. You know, just take some Advil. Well, I can't. So who shouldn't take NSAIDs? Serious side effects from taking pain reliever or pain reducer, if you've had any of those, if you have stomach problems, asthma, if you're on an anticoagulant. I mean, there's a number of reasons why people or patients will tell you, look, I can't take that. CBD is a great, great alternative and adjunct for pain control. So another thing that's come out, NSAIDs can increase the risk of heart attack or stroke. Again, my point is, this is straight from the Mayo Clinic themselves. You know, the drugs that we're recommending routinely on a daily basis have the potential to cause harm to our patients. Again, not saying they're not beneficial, right time, right place, but I think CBD products have an incredible place in our arsenal. And I know it's worked really well for my patients and myself and my family. So recent literature on NSAIDs, stomach irritation and ulcers, asthma exacerbation, GI bleeding. These are the reasons maybe your patients might not want to take them, or why maybe you should have something else to offer as well. So what other options do we have, right? Narcotics, NSAIDs, massage therapy, cold laser, ice packs, acupuncture. Let's add in CBD to that arsenal. So what does the World Health Organization say about it? No evidence of recreational use of this product associated with any public health related issues at all. No case reports of abuse or dependence, none at all. No effects indicative of any dependence. You know, they're not going to get addicted to it. It's an effective treatment with epilepsy here, according to this report. That's another thing you could use it for. So even the World Health Organization is saying, look, very, very safe, might have some benefits. Our bodies actually don't even have the receptors in the areas of our brain to cause death by stopping breathing, like, you know, narcotics and opioids can cause a suppression in our respiratory rate. There are no receptors in these areas of our brain, and so that's why they're saying there really is no potential. There's no lethal dose that's been identified at all. So this is what I'll give my patients a lot of times with whatever product I'm giving them, whether it's the topical or the tinctures that I use, is I put together a little brochure that talks about, you know, what CBD is, because there is still so much misunderstanding out there. I was just at a party the other day, and not a fancy party, just a mom party. There was some coffee, and the coffee bar had the option to add CBD into it, and, you know, a couple of the moms were like laughing, oh, go home high. And it's like, people just don't know. They don't know because it's got such a bad name when it was, you know, tied to THC, but it really only has health benefits. You're not going to get high with CBD. So explain that, explain what the benefits are, what the products are, what the doses are, talk about why I might want to use it in the practice, whether it's to help them sleep better, reduce anxiety. You know, nobody likes to come to the dental office. Digestion, we talked about the, you know, enteric nervous system. what is it, talk about facial pain. I use the topical a lot with my TMJ patients. I use it a lot with open mouth procedures, helps reduce inflammation. So if any of you guys want this, I'm more than happy to share it. It will automatically email it to you if you want to text the word airway to that number. I will automatically shoot you over that brochure. Happy to share it with you. I'm here to spread the knowledge, spread the love, and if you end up with any other questions after this webinar too, I'm sure somebody can find me and reach out to me, but I'm happy to talk to anybody about it. I just really have seen, like I said, such great benefits. I hope you all try it. A couple of patient reports themselves. Jenny here, she has TMJ issues. She uses a mandibular advancement device for airway issues. She also happens to have back and thumb pain. She uses the topical I use, which is the TRC topical, which we'll talk about in a minute. She used to take Advil every single day. She does not take it at all anymore. She doesn't need any of it. She uses this cream for her jaw, for her muscles, and she uses it on her thumb and her back as well. But all of her pain is under control, doesn't take any Advil anymore. This is Danielle. She was just in yesterday. I wanted some current patients on here. So Danielle, history of shoulder pain, TMJ pain, neck, everywhere, massaging her back and neck. So I've been treating her for TMJ issues, and I gave her some of the cream as well to go as a supplement. That's typically what I'll do. She was like, wow, I've tried everything under the sun and nothing has worked. I mean, I like to think it was my orthotic therapy, but I was really glad to be able to give her some of this too. She loves that. Belinda here, she's a sleep patient. She uses a mandibular advancement device. She has some sleep issues and she has pretty high anxiety. CBD products have helped her within weeks. She's sleeping better. She isn't as anxious. She feels overall, she said, significantly better. She comes in and just wants to restock whenever she's out. So I'll talk about the product that really we're here to talk about today too, the transdermal TRC. It's the transdermal relief cream. It's the topical that I do use. Like I said, I absolutely love it for the topical cream. It is medical grade quality. There's 750 milligrams in here. It is third-party tested, which is what I talked to you about. 2.5% concentration, which is really, I'll get to that in a minute, very important. No fillers, no scents, no additives. Sometimes patients will tell me, I can't put stuff on my face because it irritates my eyes or makes me sneeze. This has nothing that is going to irritate your patients in it. I've had zero issues with my patients that I've given it to for that. It was tested by dentists, made for dentists. It's a proprietary agent, no use for no risk for abuse. Like I said, another cool thing is it's not available to our patients directly, so they have to come to you to get it if they want it. But really, what makes it different? The 2.5 concentration, ensuring that it makes sure that it's quality and potent, so it's not diluted. A lot of other companies will charge you for the 750 milligrams, but they add in other fillers, so it's a bigger product. It's like taking your vial of lidocaine, dumping it into a bottle of water, resucking it up, and trying to get somebody numb with it. That's why a lot of these products, I think, don't work. I don't know if you guys offer Botox in your practice, but kind of similar there. You dilute it with a certain amount of saline to get the most potency for what you're using it for. But a lot of times, the sale version, they just add in a little more saline, dilute the product, and it just doesn't work as well. So that's, I think, what has made a difference for my patients with this product, because I have tried other products without as much success, is that it's very well controlled. So when to prescribe the cream, right? Head and neck, TMJ, myofascial pain, every single day in my practice. These things walk out the door. Adjunct to any oral appliance, my TMJ patients, it will increase your patient's compliance of wearing the appliances because they will be less uncomfortable during that transition period. Post-operative procedure, when you expect pain, why not use this in conjunction with myofunctional therapy? If you don't know what that is, reach out, I'll explain it. Open mouth procedures, the patients that you get, they get sore. It's a really nice thing to offer your patients. Long cosmetic appointments, chronic headaches and migraines, it absolutely helps with that. And like I said, like my patient Jenny, anybody who consumes Tylenol, Advil, and Motrin on a daily basis, you really should try to get them to try something else. So the primary objective really of this product is to have patients stop relying on pharmacology that is just covering the signs and symptoms and really manage their pain in a way that can help them better. So this is what it looks like. A lot of times I'm asked, what's the cost? So we pay $48.50 a tube, 10 patient kit, $485 a kit. I am selling it to my patients for $75, I believe. I don't always sell it to them. If I have a bigger treatment plan, maybe a bunch of veneers or full mouth reconstruction, or maybe it's a TMJ patient or a sleep apnea patient, somebody that's investing time and money into my practice, I will give them their first container of this. And I can't, so many times they come back and they're like, all right, I need another one, I need another one, I need, and then they start buying them after that. So that's typically what I do. I do have some patients though that maybe I'm not doing a bigger procedure on, and I talk to them about it and they want to try it and they buy it. Support material, this company's been great. They've provided incredible support to me. They do have their own patient brochure specific for this product. There's an instruction card that shows your patient how to use it. There's an educational video. You even get a sticker. But one of the cooler things that I like is you get to add your name to the, on the website, the doctor locator, because patients are out there looking. They're reading about this. They want to know. I mean, my mom came to me like a year ago. I didn't even know. She was scared to death to go to her dispensary to try to find some CBD cream, but her arthritis was bothering her. And I was like, I've got something for you. I can help you. I mean, people are everywhere that really want to know more because they're hearing, the rumors, the facts, whatever you want to call it. But at least I'm hopeful that this brief seminar was able to at least give you some basic information to be able to intelligently talk to your patients, your family, whoever you want to talk to about it. Go out there, do your own research, reach out to me, reach out to this company. There is no downside. There's only an upside to helping your patients, try this out and see the benefits of it.